Hello, my name is Kelsey Self, and my target student's name is Devin. Devin is a 6-year-old boy who lives with both of his parents and his 3-year-old sister. While pregnant, mom developed preeclampsia, gestational diabetes, and the HELP syndrome. HELP stands for hemolysis, elevated liver enzymes, and low platelet count. Devin was born at 34 weeks, and mom was measuring at 31 weeks at the time. After birth, Devin spent 1 month in the NICU. On May of 2017, a PEG tube was placed due to reflux and poor eating habits. At age 2, Devin was diagnosed with delayed milestones, and there are no other diagnoses. The reason for evaluation and evaluation testing was Devin was coming into kindergarten. Devin is a kindergarten student at Clarksville Primary and is in a general education classroom. Devin is pulled out for speech, resource, and for occupational therapy and for physical therapy. Devin underwent a battery of assessments for his evaluation. The first assessment is the Behavior Disorders Identification Scale, the BDIS-2. This provides a measure of behaviors that are considered disruptive or required in a classroom setting. They are not measured by academic skills testing. The scale relies on direct observation of 5 behavior areas by a teacher in a classroom setting. The 5 areas are learning problems, interpersonal relations, inappropriate behavior, physical symptoms and fears, and unhappiness and depression. The standard score is a mean of 10 and a standard deviation of 3. The subscale standard scores from 7 to 13 are considered statistically average. The school version was completed by his teacher, and the results showed to be average in the following areas: learning problems, interpersonal relations, inappropriate behavior, physical symptoms and fears, and unhappiness and depression. The next assessment is the Adaptive Behavior Evaluation Scale, the ABES-R2. This measures adaptive behaviors that are necessary for success in both educational and residential settings or home settings. The ABES school version relies on observation by a teacher in the classroom, while the ABES home version is completed by someone familiar with the child's adaptive behaviors in the same areas while in the home setting. Both versions have the same standard score to represent the mean of 100 and the standard deviation of 15. There are 3 domains in this test. They are conceptual, social, and practical. Devin scored a 65 in the conceptual area, and his percentile rank was 1. That means that he scored the same as or better than 1% of students his own age. Under the social domain, Devin scored a 76, and his percentile was a rank of 5. He scored as well as or better than 5% of students his own age. Under the practical domain, Devin scored a 78, with a percentile rank of 7%, meaning he scored as well as or better than 7% of students his own age. On the school version, his attained adaptive skill quotient of all of the sub-areas was a 77, and his percentile rank of 6 means that he scored as well as or better than 6% of students his own age. Devin also underwent the Kaufman Assessment Battery for Children, the KABC-2. The KABC is an individually given measure assessment of processing of thinking and cognitive skills of children and adolescents, ages 3 through 18. It measures the range of abilities that include processing, learning, reasoning, and other abilities. The KABC2 provides a nonverbal scale to assess children with hearing loss, moderate to severe speech or language disabilities, or limited English proficiency. Devin was administered the nonverbal index, as he has speech issues. And it is comprised of the following subtests: conceptual thinking, face recognition, triangles, pattern reasoning, and hand movements. Devin attained a standard score of 47, and his percentile rank was less than 0.1, means that he scored as well as or better than less than 0.1% of students at the same age. Devin also was administered the Wechsler's Individual Achievement Test. This Wechsler's Individual Achievement Test is given individually to students, and it measures reading, writing, and mathematical skills. The standard mean is of 100, and the standard deviation is 15. The math problem solving subtest measures untimed math problems and solving skills in the following domains: basic concepts, everyday applications, geometry, and algebra. Devin scored a 51 and a percentile rank of less than 0.1, means he scored as well as or better than less than 0.1% of students his same age. In alphabet writing fluency, students are required to write as many letters as they can in 30 seconds. Devin scored a 62, and his percentile rank was 1%, which scored as well as or better than 1% of students his own age. Also, the early reading skills measures the ability to identify letters and the sounds of letters, as well as identifying letter groups. Devin's score was a 64, and his percentile rank is 1%, means he scored as well as or better than 1% of students his same age. Devin also was given the developmental test of visual motor integration, with a mean of 100 and a standard deviation of 15. The developmental test of visual motor integration is a series of 24 geometric designs arranged in developmental sequence. The student is supposed to copy the design using a pencil and paper. Devin's score was 46, which shows that he is very low in the ability of area of visual motor integration, and his percentile rank of 0.4 means that he scored as well as or better than 0.4% of students his same age. The other assessment was Whetman's Auditory Discrimination Test, the second edition, with a mean of 50 and a standard deviation of 10. The Whetman's Auditory Discrimination Test requires that the student to affirm or deny when given a word pair. The student is to listen while the teacher or the examiner reads the pair of words. The child must then decide if the word pairs are the same or if they are two different words. The Whetman Auditory Discrimination Test was attempted on Devin, but it was concluded not valid. After reviewing the evaluation, I reviewed that Devin has several strengths. He works well with simple puzzles, and Devin identifies himself as a boy. He also demonstrates the independence and personal care, and he is confident without his parent present. Devin also can follow directions in at least 1 or 2 steps, and he can remain seated when asked. Devin can use scissors with assistance, and he walks independently. Devin also uses the restroom independently. But some weaknesses for Devin are that he shows little knowledge with numbers, and he cannot write his numbers. He also cannot copy or identify simple shapes. He has low hand-eye coordination. This is especially shown when he is assessed with The developmental tests of visual motor integration. He has low hand-eye coordination. He also has difficulty writing his letters, and he cannot recognize letters or sounds of the alphabet. Devin also cannot decode simple words and has difficulty writing his own name. In conclusion, Devin needs help or assistance with writing, written expression, math, and literacy and reading.